A popular Nigerian mental home, the Federal Neuropsychiatric Hospital in the Yaba area of the country's commercial hub, Lagos, has seen a huge surge in admissions this year. Psychiatrist hospitals, also known as mental health hospitals or behavioral health hospitals, are places or wards specializing in the treatment of severe mental disorders, including schizophrenia, bipolar disorder, eating disorders, a dysactive identity disorder, and other forms of disorders. Now, the hospital's chief medical director, Dr. Olugbenga Owoeye, revealed this during the hospital's annual scorecard presentation titled A Day with the Medical Director in Lagos. Dr. Owoeye revealed that the overall number of new cases increased by 7%, with a 3% increase in the number of follow-up patients, both male and female. The increase in admissions was ascribed to the country's increasing frequency of mental health issues, compounded by present economic challenges and other socioeconomic reasons. And of course, joining me on the news to discuss this further is the past immediate president, Association of Resident Doctors, Neuropsychiatric, Hospital, Aro, Abeokuta, Dr. Odubaku Kazim Oluwashola. Thank you so much for your time.
Good evening, and thank you for having me.
Now, let's start off with your observation as regards the trend in psychiatric patient admission in your facility, particularly over the past year. Have you noticed any similar increase or notable differences?
Yes, just as it was said by the medical director of Neuropsychiatric Hospital, Yaba, we also have similar pattern that there's been increase in the number of new patients and then even increase in the number of outpatients that are being seen in the hospital. And it's important to note that this is not just a Nigerian thing, it is a global phenomenon that even the WHO has recorded that generally in the world there has been an increase in the number of cases of mental health conditions. And specifically in Nigeria too, there has been rapid increase in the number of mental health conditions, specifically substance use disorder, uh, and also other forms of disorders like bipolar, depression, schizophrenia. There have been very significant increase in the number of cases that are being recorded.
You said that specifically substance use disorder seems to be on the highest when it comes to the ranking. Why do you think that is?
Well, let me start by saying that in recent time, for every 10 male admission that we have, not less than 7 will be due to substance use related disorder. Now, to the question of why that is, uh, apparently the socioeconomic challenges we are facing in the country now predispose people to having depression, anxiety, and a lot of people, because they do not know how to cope with these distressing factors or with these psychological distresses, they cope maladaptively with the use of substances like cannabis, cigarettes, alcohol, and even more dangerous ones like cocaine, heroin, and the likes. So majorly that's what is causing it. And then we've also noticed that there's been increased rate of use among adolescents and young adults. And this can be basically attributed to peer influence, modeling. When I say modeling, a lot of young people, especially adolescents, they look up to people that are called celebrities and stars, and you can agree with me that a lot of these celebrities, quote and unquote, into music and movies and all that, indulge in some of this use of psychoactive substance, and then the adolescents or the young adults want to emulate or copy them, and that has also been a factor. And then another factor is availability. There is availability of the substances everywhere now. It's very easy to get. The law enforcement agencies have not been doing so much in regulating the control of these substances. So those are some of the factors. Of course, there are so many factors, but because of time, I'll just limit it to that for now.
I mean, talking about substance use and abuse, we know that the NDLEA has been very active lately in trying to crack down the network of this distribution of this substance. So I don't know. I mean, through your, of course, diagnosis and also research and personal experience, do you get to talk to some of these patients as to how they get hold of this substance?
Yes, definitely. As part of our assessment is that we ask them how they get access to these substances. And the truth is that it's everywhere. It's everywhere. It's not regulated at all. They get it from dealers, and these dealers go around with it. In fact, one of the recent trend that I found in most of my patients is that even some of these dispatch riders also help in delivering substances from the dealers to the patient. So right in their homes, they can get all these psychoactive substances without even breaking a sweat. They just make the order online and then they get it. So it's everywhere. It's not. I know the law enforcement agencies like NDLE have been trying their best, but apparently there's still a lot more to be done to control the availability of these substances.
I mean, you said that they can even place orders for it online.
Yes, yes, it's that bad.
All right. Now, in your opinion, what are some potential solutions or interventions that could actually help to address this particular surge?
Well, to start with, as it said for most other conditions, that prevention is better than cure. It's even more significant when it comes to substance use disorder and other mental health conditions. It's better not to have it at all than to start treatment. For substance use disorder, I think we need to improve the education of children, adolescents, and young adults on it. We need to teach what we call assertiveness, social skills training to make people understand how to adapt to psychological distress without necessarily going into the way of substance. So some of these things have to be incorporated into our education, probably in junior and senior secondary school education, and then a lot of government policies to have to be put in place. A lot of legislations that have to be put in place, and then after this legislation have been put in place, a lot has to be done by the law enforcement agencies, and then the tertiary mental health institutions have to be equipped with personnel. So, for example, Nigeria has just over 200 psychiatrists in the whole of the country to take care of 200 million people. And according to recent data, we have more than 20% of Nigerians rather suffering from mental health conditions. So we have about 40 to 60 million Nigerians suffering from mental health conditions. So we need to also improve in this. And there has been a lot of emigration of psychiatrists to other countries. So the remuneration of doctors, trying to train and retrain psychiatrists to keep psychiatrists in the country is very important in all of this, because if there are no doctors to treat the patients, it will only get worse. So these are some of the things that can be done to curb this
All right.
menace.
All right, great. Now, before I let you go, just quickly, if you can respond in about 30 seconds. People are usually scared to go to, for psychiatric treatment, whether, for the sake of stigmatization and all of that. At what point, or what are the quick symptoms that maybe an individual should notice and say, you know what, I think at this point, I might just need some sort of professional help? If you can just take us through some of those quick symptoms that you've noticed recently, that once people notice around or about their lives, they should seek professional help quickly in 30 seconds.
Okay, well, that will be very difficult to say in 30 seconds, but we need to understand that there are different symptoms for different types of mental health conditions. But generally, almost all mental health conditions will come with a problem with sleep. So if you're having a problem with your sleep pattern, you're having some distressing feeling, you are having some peppery sensation, just feeling down, not feeling happy, feeling anxious. These are some of the things that you may feel, and it's always better to seek for help earlier than to wait till it get worse, because when you seek for help earlier, the treatment is usually better, and the person is likely to respond better to treatment than when it gets more complicated.
All right.
So, and I also need to mention, sorry, please, I also need to mention that we need to let everyone understand that it is not a crime and it is not a sin to have a mental health condition. Anyone can have a mental health condition.
All right.
Anyone can come down with a mental health condition. The
All
most
right. Thank you
important
so
thing
much.
is get help.
Thank you so much, Dr. Odubaku Kazim Oluwashola. Thank you once again for your time.
You're welcome. Thank you so much for having me.